that when we are treating vertical problems, we have to address and decide whether if it's better to extrude anterior segment or intrude the posterior one. In cases in which we can expand posterior segments of the arch, it is highly predictable to close this anterior open bite, especially because we know that associated to expansion, there is an anterior relative extrusion due to the change of the torque of upper and lower incisors. In some cases, when the chances of expanding posterior segments are not really big, like in the case we have selected today, we might have to plan pure anterior extrusion or pure posterior intrusion. In this case, for example, since we can see the exposure of the patient is not 100% of the upper incisors, we decide to plan anterior extrusion. For this, we have selected these optimized attachments in the anterior segment. So we will align the teeth in the upper arch, and after that, we will extrude them. With this said, it is important that we plan to rehabilitate the habit which is causing the anterior open bite. In this case, and we can tell it easily, even with the intraoral pictures, we know that the patient has a tongue thrusting habit. For this, we might bond some tongue tamers in both lower and upper incisors. But instead of making manual cuts with a plier, we can ask the cut designer to reduce the size of the aligner in the lingual side of upper and lower incisors. This way, there will be some space to bond these tongue tamers. This is something we cannot do with precision cuts in many cases because they are not designed to be bonded in this area, but we can ask the cut designer to reduce the size of the aligner here. So, if we say this, please reduce aligner height on lingual side of upper and lower central incisors by 2 millimeters. There will be a space under the aligner that will allow you to do it easily without having to trim the aligners. This is how common sense affects to clear aligner technique.